done into the Auckland Park Medical Depot. Will the MEC please indicate 1. When was this audit investigation concluded? 2. What are the findings of this audit investigation? 3. What is the suspected monetary loss from irregularities at this depot? 4. What are the recommendations of this audit investigation? And 5. What action has been taken to implement the recommendations made?
I invite Honourable MEC Papo to respond to the question. Honourable MEC Papo.
Thank you, Dr. Speaker. When was this audit investigation concluded? The investigation was concluded in September 2012. What are the findings of this investigation? We are unable to disclose the findings as the stage, as doing so will compromise due process currently underway. What is the suspected monetary loss from irregularities at this depot? We have to refer to 2. What are the recommendations of this audit investigation? 2 also, refer to Roman figure 2. What action has been taken to implement the recommendations made? 2 processes as contemplated in 2 above are underway in line with provisions applicable to the public service. And just to say that, and I indicated this to the committee, that when a report is before you, you have to dispassionately apply your mind before you act. Particularly if names of people are mentioned in the report. Calling press conferences and announcing things when you have not done backup, how you're going to act, is not going to help. The confirmation which I can give to Member Bloom is that we will act, but we'll have to act in line with the law, not in line with the feelings one have. So we will act. So we're processing that report, and I indicated to them that, well, there are cases of what people might want, others might have to be taken to be charged. All those categories will unfold at once, so that you don't act haphazardly, you don't act on the basis of rumor. It has to be a decisive action you actually take. So that's the answer on that issue. We'll announce quite soon the action we are going to take.
Thank you very much. Is there any member who wants to follow up with regard to provision of 138 subsection 7? No. Your supplement. Okay,
Yes, thank you, Mr. Deputy Speaker. Now, I hear the Honourable MEC. It's just that this medical depot has really let down this province for many years, in fact. I have to think that there's something horrendously wrong there, and that the rot is very deep and it needs to be cleaned up. At this day, today, 30% of essential medicines will not be reaching clinics and hospitals in time because the medical depot hasn't been fixed up. So it's not just charging people criminally, and I'm sure there are going to have to be people who can be charged criminally, and disciplinary action. There's management action, and I'm sure some recommendations are being made there as well. What is going to be done to fix up the Auckland Park Medical Depot, which, as we sit here today, is failing to distribute 100% of medicines on time and causing a medical crisis throughout this province?
Thank you very much. Honourable MEC can respond.
You see, you must separate the forensic audit from a change which we need at the depot. As you are aware, we requested USAID to actually sponsor a study of the model of that depot. They have reported on that study. It's a second phase of that study because we want to, we're examining whether the management of that depot is actually correct, because it's the biggest depot in the country. It has quite a huge budget. So our intention is that at least by the end of the financial year, they should have concluded that second phase so that we can institute management at all levels, human resources, financial, logistical issues. All those things have been looked at so that we check whether we cannot save resources in that depot, in relation to how generally that depot is actually being run. That is another work, but in the forensic was looking at specific issues. So this report, the first phase we have, we're going to get a second one, and we'll implement changes in that depot. That's why we've not appointed the head of the depot. It's somebody who has worked there who's acting in that depot, because you can't appoint a CEO of that depot when you have to actually put in place a strategy of actually running the depot effective. Even the second phase is funded by USAID, so it's not from the budget. So we'll conclude that thing and implement the recommendations. Already from the first phase, we know things which need to actually done. Some measures are already been put there. That's why you could see from 40% of medical supplies, we are sitting at 78%. With the acting CEO being there, some of the measures are being put in place, but the full turnaround of that depot will be implemented when the second phase of that study is actually done. So I agree with you, we'll have to change, and that's why we have requested the study through the help of the USAID. We're going to act on the forensic report so that ultimately we have a depot which deserves the name Medical Supplies Depot. We're also working with the National Department of Health on that issue, because this is, as I said, is the biggest depot in the country.
Thank you very much, Honorable MEC. The next question is from Honorable